housekeeping laundry, linens and trash disposal. In the home health setting, maintaining a clean and safe environment is essential to a client's comfort and health. As a home health aide, HHA, your responsibilities may include light housekeeping tasks, especially those directly related to the client's care. This lesson focuses on 3 vital areas: laundry care, linen changes, and safe trash disposal. Mastering these tasks promotes infection control, prevents skin problems, and enhances a client's sense of dignity and well-being. Laundry responsibilities. General guidelines. Always follow the client's preferences and care plan instructions. Sort laundry by color, fabric type, and washing instructions. Check labels. Use unscented, mild detergent if the client has sensitive skin or allergies. Wear gloves when handling soiled laundry. Steps for safe laundry handling. Sort clothes, whites, colors, delicates. Pre-treat stains. Use stain remover if allowed and test fabric first. Use proper settings. Cold water for dark colors, hot for whites or heavily soiled items, unless otherwise directed. Dry properly. Air dry delicate items when needed. Fold or hang clothing neatly and store them in the proper place. Special considerations. Incontinent clients. Soiled items should be handled with gloves and laundered separately. Infectious waste. Wash separately using the hottest water appropriate and add disinfectant. Follow agency policy. Changing and handling linens. When to change linens, at least once a week or more frequently if soiled, damp, or wrinkled. Immediately after any incontinence episode, bleeding, or spills. When client requests or seems uncomfortable. How to change bed linens. Wash hands and wear gloves. Loosen linens from the bed while the client is in a safe position. Roll used linens inward to contain contaminants. Place soiled linens in the designated laundry bag, never on the floor. Apply clean fitted sheet, followed by top sheet, blanket, and pillowcase. Ensure no wrinkles to prevent pressure injuries. Offer comfort by checking pillow support and blanket coverage. Safety tips. Always lock wheels of the bed if hospital type. Keep side rails up if the client is at risk of falling. Do not shake linens, which can spread germs. Trash and waste disposal. Types of waste you may handle. Regular household trash, for example, food wrappers, tissues. Medical waste, for example, used gloves, wound dressings, incontinent briefs. Disposal process. Wear gloves when handling any trash, especially medical waste. Use separate bags for regular versus contaminated waste. Place waste in tied, leak-proof plastic bags. Dispose immediately, never leave full bags in the client's room or kitchen. Follow agency protocol for any sharps disposal, usually not the HHA's duty, but know what to avoid. Odor control and cleanliness. Remove trash daily or more often if it contains food or waste. Wipe trash bins with disinfectant regularly. Always wash hands after removing gloves and trash. Promoting a clean and comfortable environment. Even small tasks contribute significantly to client well-being. Many clients feel vulnerable, depending on others to maintain their home. By keeping their living areas clean, you help promote mental wellness, reduce infection risk, and show respect for their dignity. Key habits. Tidy up as you go. Don't wait until the end of your shift. Always ask permission before throwing out personal items. Provide choices. Ask, "Would you like fresh sheets today?" Or, "Would now be a good time to take care of laundry?" Laundry, linens, and trash disposal are essential for a safe and sanitary home care environment. A home health aide's attention to detail supports both infection control and client comfort. Proper procedures and consistency make you a trusted and effective member of the caregiving team. Proper laundry, linen care, and trash disposal keep the home safe and sanitary. Your attention to detail supports infection control and client comfort, making you a trusted and reliable member of the care team.